Hello there guys and welcome back to Big Pharma. Okay, so last time we did a few production lines. Some of them were successful, some of them were less successful, this one especially. But we had to get a loan out and now it's probably going to go a little bit kaput from here. We really need to find out if we can find the sweet spot for the alleviate insomnia. It's going to cost us quite a bit of money though. That's my worry. It's going to cost quite a bit of money. So let me find out where the alleviate insomnia actually comes from. It comes from there, doesn't it? Or does it come from there? Hang on. Oh, it comes from there. Okay. So let's plot that there. Oh, I'm going to now room, am I? Well, that's alright. We can move that for now. It's just a quick fix, just until we can get the true strength. It's probably worthwhile doing. Right, while we're at it, let's just check our research again. Yes, let's knock another ionizer on there. Probably going to knock another agglomerator as well. Oh god, we've actually got quite a lot of points here. Let's stick you there. And then we'll have enough for another discount from you. Okay. Now we're just waiting now to see the the max strength. Concentrate. Oh, ginger beer. Lovely. Alright, so we have the induces nightmares. Yeah, and it was quite near the induces nightmares. Well, it can't get rid of that, can we? No. Current strength for that is 35%. Current strength for that was 60. Now that's... the max strength is at both. Is it worthwhile giving it to max strength? Well, I'll tell you what, because we have got it is going through a creamer rather than a pill printer, it's probably worthwhile trying to knock that on the head a bit. That one is actually an easy fix. All we need to do is get another agglomerator and remove this evaporator. So let's see what we can do with this. Hang on. So let that run through a little bit. Let me just double check, see if we do just need another agglomerator. I think we do. Yeah, another agglomerator. So this is going to be a bit difficult to plop down now, isn't it? It's only point of having bloody 20 million agglomerators. Nah, it's not going to quite fit. Alright, I know I'm going to have to do at this point. I'm going to have to knock that on the head. Bring it there. And that can go there. That's better-ish. Choosing a bit more. Oh, shit, no. Can't even do that because that's... Right. This is wasting a lot of money trying to get this right. I've done it again. What the fuck have I done here? Oh, pause. What the fuck have I done here? Oh, Feng, you're not thinking, are you? Right, let's just do it like that. It's so much easier. I don't know what the fuck I was thinking there, doing that. That was weird. Okay, so now we've got another, we'll plot that in the agglomerator. So at least the process costs are going to be a lot less. Now let's see what we do with this. Let's see what... Our profit on that is a bit, possibly a little bit less, but it should get higher over time now because we've got the max strength on that. Yeah, obviously we're going to have more nightmares induced. We're going to have to try and see if we can increase the creamer efficiency. There we go, let's do that. Alright, so now what we need to focus on is multi-mixer, so let's grab on that. We are losing money at this point. That's what I was kind of worried about. Alright, let's just check this. So that's a C+, that's the one we just made. That's the Agino attacks prevented. Is it worthwhile finding the max strength for that out before making the second line? I don't think it is. I think we need to make a second line. We have to make a second line, another line or something. We've got all these already though, haven't we? Maybe we should do... Actually, yeah, Sue's Rash would probably be a good one to try and do. Yeah, we haven't actually got Sue's Rash yet, have we? So let's go ahead, and I might even just put that through there first, just to find out where the max strength for that is. May as well. Then we'll get to max strength, and that should sell pretty easily. I'm just hoping it's not right at the end where the Neville's pupils is. But there is quite a big market for that. There's quite a big demand for that, I should say, not market. So yeah, if we can get that going, that would be fantastic. Okay. Yeah, Neville's pupils. So the max is right there. That's okay, as long as the max for Suvash is not there as well. If it is, then we've got to heavily invest in that creamer. Okay, that's actually not as bad as I originally thought. That is going to be literally... No, it's going to need an agglomerator and an evaporator. That's not too... That's nowhere near as bad as I thought. It could be better though. I mean, it's still using quite a lot of machines here. But on the plus side, at least now we can use these fucking pill printers. Alright, so one there, one there, one there, one there, one there, and one there. Now we should be making a profit, and that's the important thing. We need to try and pay off this bloody loan. It's still got a lot, but hopefully as long as we make a profit, yeah, we should be good. Might even want to put one in the pill printer now. Oh, okay, that's actually pretty good. Yeah, we're going to make a fair bit of profit from that. I don't know if it's going to be enough to cover the expenses. Yeah, it's not quite enough, although it might get higher, so we might get luckier. That's gone to a B. That's fantastic. I was actually thinking that it'd pull you around there anyway, but that's ideal. At least it's giving me a bit more money. I'm really debating whether we should test that one. Hey, we're in the green now. That's fantastic. That is a really good sign. And also, we can now go ahead and upgrade you. And I may as well upgrade you because we're going to have to use you very soon. I think, yeah, the next one we need to think about is starting to get our finger medication now. We do need an autoclave, which means we do need 2 more researchers, which means we need more profit coming in. It's not any problem. Yeah, we're going to need a cryogenic condenser for that. Which does mean 2 more researchers. But again, we still need to get the shake on the multi-mixer going first anyway, and we also need to buy a new room, which we can't afford yet. It's going to take a bit of time, this. Really want to test the angina medication. And just hope that we can get to it without going too overboard with processing costs. Come on. Alright, we got 2. We need 4 for the next one, don't we? Yeah. And obviously, our scientists are busy trying to get the shaker as well. Might actually be losing the money at this point. I'm just going to quickly do a quick save here just in case anything happens. Right. Aha. Fantastic. I really should stop drinking ginger beer while I'm commentating. It's not very good to have your throat like that. Bloody hell. Right. So, 1 agglomerator, 2 agglomerator, and an evaporator. So if I go ahead and keep with that, stick another agglomerator there. Oh shit, it had to turn ring, didn't it? Insufficient funds. Ah, shit. No. That's bad news. Now we can't even afford to do that. Shit. I'm going to have to get a new loan. I'm going to have to get another loan out. I'm going to have to get a new loan out to pay the old loan. Shit. Alright. Repay that loan. Oh my god. Completely buggered this up, haven't I? Right. That should be right now. Yeah. Okay, so that will be max strength. That will make the curating a hell of a lot higher. It's going to give it more profit. Can't believe that. At all. Bloody hell. That's pretty good. We should probably test the antihistamine as well, but I'm not going to bother. We now need to start making profit, and we're not making profit. Oh dear. Oh dear, oh dear. This is not going so well now. I'm just thinking what I should upgrade next. Infection. Let's have a look at the infection. It's not great. Okay, we've finally unlocked the shaker. We have got enough money to buy some new rooms though now, but we're not going to have enough to pay for that. At least we're in the green now, sort of. I suppose it's because that's enabled to C+, yeah. It's only making $48 though, that's pretty crap. I'm going to have to really leave my researchers on. But at least now we can buy this, and we're going to need... Oh, Feng! No! We need more sockets. That's not good. That's not good at all. I might have to get rid of this Sue's Rash, because we're not going to have enough sockets else. That's bad news. I completely forgot about that. Right. Alright, let's start off with the shaker. So we'll start off over this section, I think. Yeah, start off over here. So if I stick the shaker there. The one that needed to be shook was... which ingredient needs to be shook? I don't think it really matters whichever one gets shook, as long as that one gets there, and that's the... Yeah, okay, so we'll do this one. We'll shake this one. So there's going to be a process time of 2. You can't. We're not going to be able to have it anyway because we need a multi-mixer. It's very difficult to make a dual multi-mixer, especially if you've only got a very small amount of room. So I'm not really too fussed. So we'll do that. What I will do though is have a look and see if anything can be removed. That one can be removed with an evaporator and an evaporator. Causes constipation, but I think that's going to get overwritten anyway. In fact, yeah, those are going to get overwritten anyway, so that's not a big deal. So now we've got that. Now we need the it is the antihistamine, isn't it? Yeah, it is, yeah. So we can't remove the induced nightmare anyway, and obviously we can't remove the catalyst, otherwise it's going to be completely useless doing this. So with that in mind, let's go ahead and look these up. This is obviously going to cost a bit of money to do. We need to make sure that that's the base. Yeah, that will get mixed, and we have ourselves a somewhat decent ingredient. Alright, so now we need to upgrade this to alleviate insomnia. So we need to give it down and then evaporate it. So we need to ionize it, then evaporate it. So let's get an ionizer this side. and evaporate it. No, not evaporate it. I'm being stupid. Dissolve it. Duh. Okay, so there we go. 1 and 2. Let's just see how that goes. Okay. So now we've got the alleviate insomnia. Now this is the bit where we need to think about now. So we need to get it to 11 concentrate. Since this is already going at 2, I'm actually thinking whether I should just do a dual cryogenic condenser. Actually, I can't. It doesn't matter because I'm still going to need something else to go on top of it, aren't I? I might as well just dual agglomerate it. Yeah, let's dual agglomerate it, and so much easier just doing that anyway. So let's just do that. There we go. Try and save a little bit of space. And now this is where we really need the other researchers. You know what I'm going to do? I'm going to go ahead and hire 2 more researchers for now. And I'm going to go ahead and fire both my explorers. For now. And I'll just make sure this is a bit cheaper. This is going to make sure that I've got enough money coming in now so that I can actually afford these scientists. However, I'm still going to be patient and wait till we get a few more points so that I can actually make this a bit more feasible. So I think, have we got more ionizers than agglomerators? You know, it'd be really cool if we could have like a bar or something in a tab saying what machines we have currently. That'd be really cool if we could do that, so you can see exactly how many machines you've got running, and you know, so as we can decide what's the best. I think the agglomerator is probably the better one to go through anyway at this point, because pretty much every line is using an agglomerator, multiple agglomerators even, so we'll go with that. That should really bring our money up to the green now, pretty much. There we go, it's in the green. Fantastic. Right, now we need to start focusing on advanced processing and then get the cryogenic condenser. This is the cryogenic condenser, isn't it? Or am I going cuckoo? No, it is the cryogenic condenser. Obviously, the only problem is now I'm going to have to get rid of this line once this is fully functional. Okie dokie. Let me do a quick save here, just on the safe side. Keep calm and carry on. Yes. Just overwrite it, 'cause that's fine. Did I buy a new dissolver when I've got one there already? Oh, Feng. You're a plonker, aren't you, sometimes? Alright. That's one. Yeah, all these have been tested anyway, so that's good. I suppose what I could do for now is test the other ingredients and see if they're all right. And try and test their concentration levels. You know, the side effects and whatnot. I mean, I'm kind of hoping that we can land on the gout, prevent gout as well, because if we can do that, it'll then be a double cure, and that'll be fantastic. But I've got a feeling that's not going to be the case. I mean, if I really, really wanted to at this point, what I could try and do is get another ingredient that's got the green catalyst, although I haven't got no explosion here, so that's pointless. I mean, this is only working at 50% efficiency as well, because obviously it's only getting ingredients every other day. Not good. I've still got 3 months to go. Oh, we've got a few more points now. We've got 2 more points. I'm going to stick one in both of those, like so. I ain't found nothing yet. Oh, come on, find something. Come on. Come on. It's not going to find anything, is it? Oh dear. Oh, there we go. It's found the alleviates insomnia, the one that we don't actually want. We want the induces vomiting and prevents gout, really, but it's actually costing us quite a lot of money, this. I'm debating whether I should just leave it. That's a bit. Look at all these are gone to A now. These are 25%. It's making us quite a bit more profit now, so you can't really grumble at that at all. That's pretty good. In fact, if I stop that, that'll probably go to the green now. Obviously, after all this has stopped functioning, which it will do. No. There we go. Then we'll stay in the green pretty much. Let me check my loan for that one. Yeah, we might get lucky and be able to pay that off. I mean, we are getting quite a lot of money now. Wow, I'm actually really surprised how much money we're getting from that. Okay. I might go ahead and put a few points in dissolver and evaporator. Since we have got a few dissolvers, and I think we've got like one evaporator. So we may as well do that one as well. Obviously, I can't nothing that one because that's the Explorers. Yeah, we're now going roughly 90, just over $95, something like that per day, roughly. So yeah, can't really argue with that. They've got some really crap curatings in some of these, haven't they? That's not too bad. Sue's Rash isn't exactly brilliant though. I actually managed to get rid of mine completely. Fantastic. Come on, come on, come on. I mean, once we've done that... Oh, it's done. Shit, I didn't even realise it was done. That's some good, ain't it? Right, cryogenic condenser. We've still got 2 points. I think I'm going to actually spend one in cryogenic condenser. I will stick one in the pilferings though, since we've got a few pilferings now. So that's probably going to give us an extra $6 on top of what we're earning. Roughly. Yeah, it should do. Oh, hang on, how many pilferings are we using? 2 lots of pilferings. Yeah, 2 lots of pilferings is 2 lots of creamers. Lovely ginger beer. I think this is the part really where I would love a quadruple speed button or triple speed button, because we're basically now just waiting for this research to be done, and that's it. There's not really much else we can do while we're waiting for it. And as you can see now, 7 months, that's going to take a while. I think what I might even do is I might even put a pause in here while we're waiting, because we can't do nothing else, and I'm not going to touch anything else until it's done. So I'm just going to stick a quick pause in here. Also, I have a feeling that we're not going to do the master on this by the look of it. I mean, master needs 16 months. I don't think I'm going to do it in 16 months at all. I mean, I think we need about 4 more months for this, don't we? Or maybe, yeah, 5 months. Yeah, that's going to be undoable at this point, I think. We might just about do expert, but we'll see. Alright, so we're not quite there yet, but as you can see, we're now starting to hit the red a bit. Now I'm a tad bit worried. It's still going to take 3 months for these to actually finish. I'm not 100% why we're losing as much as we are. Actually, that's gone up a little bit more than it should. Yeah, that's increased in price. Wow. That's bad news. That one slightly increased in price, that one hasn't. That one did, but then didn't. I think it might be because of the demand of the cures as well. Yeah, I mean, yeah, antihistamine has gone right down, so relieves hypertension. I don't think I got over those, have I? Antihistamine relieves hypertension. Yes, I have. Oh god, yeah, I have. Antihistamine's gone right down to 28. Shit. That's not good. Oh my god, the Sue's Rash has gone down to 29 as well. Oh dear. We could be in trouble if we don't get this going straight away. I mean, oh. I'm going to repay the loan off. And that should get us back into quite a bit of the green. Yeah, it has. Whew. That was lucky, wasn't it? Still, you know, it's still not. It's still. I was still a bit worried about it though, because we might still need to borrow some more money if we're not careful. If it goes below that again, that's just going to be a bit silly, I think. How are we doing? One more month. One more month. Okie dokie. Only a few more days left, which is fantastic, and then we can crack on with getting some cures done. Alright, let's do a straight upgrade on that. Hopefully we don't need an autoclave, but we might still end up needing an autoclave for stuff. But we'll see. So, let's grab our cryogenic condenser. Of course, it has to be that way around, doesn't it? So we'll stick it there. Alright, so there we go. Oh, yeah, okay. Okay, so yeah, we're going to need that as well. Unless we use a shitload of ionizers, which I am not going to be doing. That is silly. I'm not going to use a shitload of ionizers on that. I don't believe that. That's a bit silly, really. On the plus side, though, we might be able to hit the prevent scout if we stick it there. Shall we check the max strength? I think we should. Oops. We should still be in the green by doing this, I hope. It'll be worth it if we can find out what the hell it is. Can't believe that. No one need an autoclave anyway, so that's that's completely fucking pointless. Oh, GG. I mean, the great thing about if we can get that to work, that's a big if. Yeah, that's a big if we can get to. Oh, hello. Induced vomiting. If we can get it to work, we can use the sachet mixer, which would give us quite a big bonus of $15 for each cure affecting the drug. It's actually probably the weakest to use it on just one cure, but obviously if you got two cures in a drug, then yeah. That'd be fantastic. I don't know what I think that might be a process time of 3 though, and we're more lagging by a process time of 2. And if I made just one of these, it'll take 3. I might be able to make 2 of them, but it won't be very efficient. I think it might be worthwhile just going for the creamer. The syringe will be pointless, I think. Because syringe is also free. Process time. Well, let's see. Okie dokie, so we finally got it. Oh yes! How much luck is that? That is fan-fucking-tastic. Oh wow, and I bet that won't even be half as bad as it looks. Wow. Now it's tempting to get the sachet, although we're actually not going to be able to do it, are we? Because we need a lot of scientists for that. To be honest though, I could probably go ahead and hire 2 more. For the time being. Since we're not using any explorers anyway, so we may as well. But that's handy. That is really helpful. So we need to get to 5. So actually, you know what? That's that's brilliant. That's 2. That's 2 of these. That's 2 of the autoclaves. That's going to be really simple. 2 autoclaves, and then we can stick it through a sachet maker. Although, obviously, as I said, we might not be able to do that straight away. Well, we're not going to be able to because it's going to take 7 months. I think what I'll do is I'll make it into a cream first, and then once we've unlocked the sachet maker, then we should consider doing that. Yeah, that sounds like a good idea to me. Yeah, I think that's what we should do. Wow, I'm making a lot of profit from Summit. Oh, they've gone back up. Oh, brilliant. Well, that was lucky then, wasn't it? Looks like the demand's gone back up for it. Yeah. Cool. Trees enjoying a little bit in Sonya's a bit of a woofy though. That's why they've gone down a little bit. Ingredients have put, yeah, they've gone, the cost's gone down as well, so that's useful. Okay, I'm going to stick a cut in here then, guys, and I'll see you next time.